All right. Welcome back, my regular viewers, listeners, and watchers. And of course, if you happen to be here for the very first time, welcome. Before I go any further, my name is Rahul George, India's premier iHypnosis life healer coach and your personal guide. And for those of you who've been tuning in and have been following along on our very special and specially curated podcast, the iHypnosis Coaching Journeys, this, of course, as you know, is the um, curated. As I said, it's literally like looking through the length and the breadth of our country, finding some truly amazing healers and coaches, people who are already on the journey, and you get to hear firsthand not only their experiences but also decisions that they made that have brought them here, and you also get to know more about their life story and their mission and what keeps them so inspired to keep going. So with that, of course, I have a very special guest. This is, of course, your cue. So, Dr. Aarti, you can go ahead and turn on your camera. And good to have you here. Firstly, thank you for making the time on a middle of the week busy day schedule, but you've made the time to be here. So thank you so much, and welcome.
Thank you, Rahul, for having me, and thank you, everyone, for joining us today.
Amazing. So, we've had a lot of healers, a lot of coaches, especially people who have been, maybe they found their calling post COVID. So over the last couple of years, they've, that's been their track. Maybe they were doing something completely different, but they were inspired to tap into the healer in themselves and, to be able to help more people. So that's one track of people that we have been inviting on this podcast. But there are also other people, and I know you fit beautifully into that category of people who maybe even before or much before COVID, you knew that you were meant to be in this space, and yet you've chosen to create your own path. So maybe to start with, if you could tell everybody here who's listening, what is it that you do? Like when someone says, "So, Dr. Aarti, what do you do?"
I'm a psychiatrist with a unique specialization in integrative nutrition and mental health.
Mm.
So I'm practicing nutritional and metabolic psychiatry in Jaipur.
Mm.
I help people in healing their brain by working on the root causes
Mm.
rather than treating symptoms only.
Mm.
Though I'm practicing conventional psychiatry also, because
Yes.
everyone doesn't have mindset of investigations and all.
Mm.
But this nutritional medicine approach, or the nutritional and metabolic medicine approach for the chronic disorders, this is my passion.
Amazing. Just listening to you, and I can sense there's literally a story behind how, over a period of time, you kind of discovered this path, you created this path, though you may have started in a traditional way, but somewhere you've kind of shaped this path. So maybe if you can take us back in time to how you kind of built this path over a period of time. Like what's the story been? What's the journey?
So until 2017, I practiced like a conventional psychiatrist. I
Mm.
was heading Department of Psychiatry, Santoba Durlabji Memorial Hospital. This is the biggest hospital of Rajasthan.
Mm.
My life was good. I was happy with my profession.
Mm.
So one incident has changed my life.
Mm.
I was helping a young child, 6-year-old child, for repetitive irrational thoughts. Child was irritable, on and off restlessness was there, and school refusal was there. And he was my friend's child, very close to family, very close. I was failing. I should say I failed once, despite doing psychiatry for 14 years. Huh? I was failing, to be very much honest. Nothing was working. Anyhow, after 1 month of that episode, child had fever, and the family decided to go to Vaishno Mata, and they wanted something should be given, and we have given amoxiclavulinic acid, just an antibiotic. By third day of antibiotic, child's repetitive thoughts started going away. I was like, what is this happening? I haven't never seen in my literature infections and mental health connection. I talked to 10 people. I was not getting answers. And that time, when I started searching what exactly are my answers, there is an international physician network. They helped me, that Pandas Physician International Network. They told me about that chronic infections and the gut infections and mental health connections. They told me about that.
Wow.
Now, after working with this child with some chronic infections, investigations and all, he improved, but some improvement in hyperactivity was also required.
Mm,
Mild component of hyperactivity, focus.
mm,
uh, So I started digging in, and thereafter,
mm,
uh, people from PANS International Physician Network, they told me
mm.
about the nutritional medicine, and this is how I started doing fellowship program in nutritional and metabolic medicine.
Wow.
In this journey, my hypothyroidism reversed,
Wow.
and after that I got hooked to this kind of approach.
Wow.
After that, it was like I didn't want to leave that because
Amazing.
I loved that thereafter.
Right. Wow.
So it's not only for mental health, nutritional, metabolic medicine,
Mm,
definitely for chronic health issues. But no doubt, when we work at the back
mm.
end, that how stress is impairing your hormones, and we are working on the hormones or the causes of the mental health issues,
Right.
it works beautifully. Beautiful.
Amazing. Amazing. Wow. Just listening to you again, it's like you can tell how much you love what you do. But something that I love about this pod and this podcast is that this is an opportunity for people to get to know your history. So it's like saying, if I ask you, were you that child that was like, even as a child, okay, I am going to become, a doctor, or like, how did your journey of healing, how did that begin? Like, what was the earliest um, indicator or insight that you had कि हाँ ये करना है मुझे?
When I was 10 or 12 years of age, my grandfather used to
हाँ.
say, you need to serve community.
Hmm.
And I used to say, why doctor? Everybody is doing
हाँ.
business in this family.
Correct.
After that, in 12th standard, I was underage for exams, this PMT exams, and I was eligible for this engineering exams. My
हाँ.
grandfather said, no, you're supposed to become a doctor.
Wow.
So he wanted me to become a doctor. And
हाँ.
to be very much honest, I didn't have any insights. Later on, I came to know what's the meaning of that.
Right.
So definitely,
Wow.
this is like from the family side, karmic accounts, serving community. So I
Amazing.
very late I started realizing meaning of
Right.
these things.
Wow. 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 So walk us through, like, how did that happen? So like, you went through the exams, then you went through, I guess, 5 years of medicine. So what was, like, what were your thoughts at that point? Like, some people go in with one idea, they come out with a different idea, right? Like,
I was following the model blindly.
huh,
I didn't have any different thought process.
huh,
This is the only incident. And before that, when I was practicing psychiatry, I was into
huh,
spiritually oriented psychotherapies.
hmm,
I used to believe that only CBT doesn't work. If
huh,
some spiritual component is there, it works better. That's it. That's it.
hmm,
This incident has changed everything.
wow,
It's changed everything for me.
right, hmm,
And
hmm,
after that, when I started exploring different psychiatric disorders, I started understanding how many myths are there,
right,
because people feel the stress, long term stress is the depression. They don't
hmm,
understand the process from stress to depression.
hmm,
So it's like working at the back end. Whatever the damage has been done,
yeah,
try to repair it naturally. Things will get
right,
settled down.
amazing. Wow. Okay. So I'll go at it a slightly different way, because again, I believe there are these um, untapped diamonds sometimes. So it's like, when did you know, even though you said, okay, your grandfather told you that, community service, and then you decided, okay, I'll do medicine. But even with medicine, there are so many, being a doctor, you could be of any number of fields, like, or let's say subclasses. So what made you choose psychiatry over so many other choices that you probably would have had at that time?
Uh, Nothing major at that time.
Okay.
I have never thought so
Yeah,
much.
yeah.
I was
Huh.
simply, I'm liking this or
Mm,
nothing major. Definitely, this was the incident. I was blindly following allopathic medicine. I was,
mm,
I was like, when I have seen a child recovering from repetitive irrational thoughts. I
mm.
have seen a child recovering from ADHD, hyperactive child. Now
Wow.
he's a topper in school.
Mm,
I've seen my own hypothyroidism. When I started
mm,
working on nutrition and lifestyle on my hormones, I
mm,
got hooked to this kind of medicine.
mm,
I got hooked to. Okay,
mm,
definitely, all modalities work for stress, like your inner child healing, your spiritual processes, your
mm,
cognitive behavior,
mm,
psychotherapy, hypnotherapy, everything works. But
mm.
this is some missing piece of knowledge, that how can you repair the damaged part also at the same time? Do all.
Right. Mm, right. Yeah. Yeah.
So, to be very much honest, I was honestly blindly
Following the.
following all the processes, like, okay.
Mm,
And thereafter, this incident
got it.
totally changed
Okay.
life.
Okay. So, um, like you said, that was like 2017. So it's been about 8 years now, right? Give or
Right.
take about,
Hmm.
yeah, right? Where you had this experience and that kind of like opened up the doors, the portals for you to start looking at other aspects. Walk us through what was that journey, like the first maybe 6 months, the first maybe a year, first two, yeah, that.
After healing that child, my
Yeah.
first client was a schizophrenic patient where
Mm,
it was
mm,
medication resistant. Multiple hospital admissions, but nothing was working.
mm,
So investigated, because I knew there is some other cause, because this is the beauty of this kind of approach.
mm.
His serum aluminum was high. I
Wow.
detoxified for a few years. He doesn't have any schizophrenia. So
Amazing.
the beauty, and recently only I have published this case in an
Mm,
international newsletter, and
mm,
it is like I started observing miracles.
mm.
So earlier, it we used to believe that stress is the cause,
Right.
huh? And people think that maximally about hormones or nutritional deficiencies, but not beyond that.
Mm.
The
Correct.
depression is, or some disorders is stress. Definitely, they understand this. People understand about hormones also a little bit, huh?
Mm,
People understand about nutritional deficiencies also,
mm.
but there is a game behind this.
Right.
People are not aware about the major causes of these psychiatric disorders. These are inflammation, the fire in the body that's going to the brain. You need to reduce fire in the body. People miss this.
Wow.
There is a triad behind this. One side is inflammation, one side is hormones, and other is gut microbiome. I'm sorry, these things can be little technical, huh?
No, no, that's
Yeah, little
it's
technical,
yeah, it's totally
huh?
fine.
So people miss that long-term stress can cause inflammation.
Mm,
Definitely, when you start healing people with other healing modalities, this inflammation gets reduced. And
mm,
evidence-based data that spirituality heals inflammation.
mm,
But what if
mm.
you start working at the back end, also started investigating and working at the other part
Right.
first? So it will give
Mm,
a push.
mm.
In a lesser period, you
Right.
can start the healing process. One is
Mm,
inflammation. The
mm,
other part is people forget that if there is a long term stress, their intestinal lining becomes
mm,
hyperpermeable,
mm.
gut becomes leaky,
Right.
there is inflammation, there is a bad
Mm,
microbiome there.
mm,
So other is, if stress is for the long duration, hormones, subclinical thyroid, obesity.
mm,
So if you
mm.
work at every aspect,
Mm. Mm.
You can speed up the process.
Right.
So definitely I'm discussing some concepts. It's healers definitely they can understand,
Mm-hmm.
but sometimes it's difficult to.
Sure.
But the most important thing is why some people face these disorders.
Mm-hmm.
Why some people are resilient
Correct.
means something is in the system.
Mm-hmm. Yeah. Yeah. So I'm going to ask you a slightly sort of like a parallel question, because obviously it sounds like it's something that you really believe in and you've seen it work. In your through your experiences, could you share with us a little bit about spirituality and how you see that playing a role in this kind of work that you do?
I feel
Mm,
families who have good spiritual system,
mm,
faith
mm.
in the process.
Right. Yeah. True.
Uh, if their own system it is very strong, and I try to work on that system also,
Mm, mm,
but I think this is something changes game,
mm, mm,
because I feel I need to. I'm not working that much. Something is working अपने आप.
mm. हाँ.
बहुत ज्यादा नहीं करना पड़ता है.
Right.
So strongly believe this.
Amazing. Let me ask you in this context again, because of your background and your um, let's say you have a scientific background, right? Like you've studied and you've like obviously researched deeply from the science, from a very Western approach of um, you know creating harmony in the system. And then on the other hand, being Indian, and of course, there's the whole cultural aspect of it's in our bones, so to speak, right? That we talk about spirituality. Why people from the West come all the way here? Because there's something about it's in the air. We literally had like lakhs of people come from all over because there's something about this land, and there's something about this which you can't really put your finger on, but it's there, right? But having this on the one hand scientific background, and then when you talk about spirituality, I find it beautiful. But again, I'm sure there are not a lot of people who who openly are willing to blend the two. So when did you start to notice that let me do both?
I think this is before 2017 only. It is like
Okay.
it was imprinted in the system.
Huh.
I knew that because the family was like that, karmic accounts,
Ah,
that was there in the system.
right.
That is uh, that is from childhood only.
Mm, right. So you sort of started to. So
I
how,
was I was not doing anything. It's like
mm,
childhood was like that,
okay.
like from early morning mantras and some havan
Mm,
at home.
mm,
Atmosphere was like that only.
mm,
Talking about principles in business, value
mm,
system in the business.
right.
Giving is more important than taking. These all things were already in the system from very
Mm,
beginning.
mm,
There were strong beliefs from the childhood.
mm, mm,
So I think this is up to 2017 uh, explored this new
mm,
dimension, and I feel it was blessing in disguise. Anyhow, that incident was painful, but after
right.
that I was able to help many people like
Mm,
in disease reversals also.
mm, mm, right. Okay. Okay. That's beautiful. I mean, obviously, this has made an impact in your life, and you get to share this with so many people.
Hmm.
Um, if we look at, especially post 2020,
Hmm.
what are some of the typical things that you have seen changing? Because I have seen personally a lot of awareness, a lot of people openly talking about mental health, people actively seeking to heal, and then of course the extension of that is where some of them continue on to help other people in the role of the healer or the coach. So What are some of the things that you have noticed since 2020, Dr. Aarti?
See, no doubt prevalence has increased,
Hmm.
but we need to understand why it has increased.
Hmm.
This why is more important to understand.
Hmm.
Earlier, we used to feel that this is the stress which is responsible, or the COVID stress
Hmm.
is there.
Hmm.
We need to understand there are two other factors which we are missing out:
Hmm.
diet, toxins.
Hmm.
Your brain loves your hormones. Brain doesn't want any fire in the body. If you are
Hmm.
creating inflammation yourself in your body,
Hmm.
so definitely this is stress. Agree.
Hmm.
But what exactly is the cause? Earlier, kids they never they never complain about anxiety, irritability, anger issues. It was never there in our system.
Right.
Child psychology or this or that, so much psychotherapies, never. So we need
Hmm.
to understand what exactly is the cause: stress, or the other two also, diet and toxins.
Right.
So this is a combination of all three. We can't
Hmm.
ignore these two things also. So
Hmm.
for healing also, we need to work here also along with the stress.
Hmm. Right. Hmm. So give us a sense, like, when typically somebody comes to you, like what happens? Like, because a lot of times people only see it in the movies, or what was that? Love You Zindagi? I think that was the movie, right? Where you see, like that's probably the closest that a lot of people would come to when you think about a psychiatrist or you think about a therapist. For most people, there is obviously a percentage of people who are now starting to actively seek that help. But typically, when someone comes to you, like, what happens on the other side when the door closes? What's that like?
See, for psychiatrists in uh, for psychiatry practice in India particularly,
Huh, huh.
people who are having moderate to severe illnesses, they are only coming.
Mm,
People are not coming at initial stages.
mm,
For me, resolving medication resistant cases, I love that,
right.
because I feel that is something I can work on the
Mm,
hormones or the gut health. I'm working on the, at the back end area.
mm, mm,
So there is no question that because they are not getting relief. For me, this is important to give some results in 3 to 6 months only.
right.
So no questions, nothing is there.
Mm,
Definitely, there is a clientele, stress, mood swings,
mm,
mild level, and they are looking for some holistic outcomes.
mm,
For that, these anti-aging medicine strategies, or like balancing hormones particularly,
mm, mm,
it works.
mm,
No doubt, stress are the other healing modalities like stress management or other things. They also balance your hormones.
mm,
Certainly.
mm, right,
But
right.
for some people, the cause could be something else, diet and toxins.
Mm,
It's like connecting the pieces of the puzzle.
right, right. Mm, mm.
I hope I
No,
haven't
absolutely.
confused.
No, like I said, the purpose here is for people to get to know you better, and the world in a way is changing because people are, it's like saying people want to know more about whoever that they're going to see, right? So when they get to know you better, that's the reason why this pod exists, so that they get to, get a slice of your life, like how did you get here and what makes you so passionate about what you talk about. So that's something that they've definitely got a deeper insight into. And say, when the work that you're doing at this point, do you only work in the hospital, or are you, on online? Are you looking to build like a community where, people can meet you, or people can connect together? How do you view that now?
To be very much honest, when I started my journey in 2017, I was just exploring what are the causes of
Hmm.
disorders,
Yeah.
nothing else.
Huh.
Around 2 3 years ago, when I've explored, everything.
Huh.
And
Mm.
like after settling many clients, I was feeling that how can I inform people what I'm doing.
Yeah. Yeah. Yeah.
That time, definitely, I understood that this is how social media information, this all
Mm.
works, because I didn't have technical skills. To be very much honest, I didn't have. Now I feel after
Mm.
good clientele, good satisfaction in work, I feel like giving back to the community.
Mm. Mm.
2 years ago, when I started learning all this stuff, I used to feel for how I should tell my clients that this is how nutrition, hormones, detoxification, diet, everything is related to your mental health. This is around
Mm.
2 or 3 years ago. I used to feel like that, but
Right.
now thought process has changed. It's like, how
Mm.
can I share the same knowledge with other health coaches?
Mm.
So I started working on that lines now,
Mm.
so that if someone is working for specific hormones, specific nutrition,
Mm.
or gut health nutrition, I can teach people so that they can help
Mm.
many.
Nice.
Now
So
change, little change.
beautiful. That's that was what I was telling you when we started this conversation, that there's something that you're doing that is very directly linked to the audience that is our audience. That's the common audience, right? When did you have that realization that okay, maybe I can take all my knowledge, my what you have, the wisdom that you've gained over so many years, and let me now, instead of only talking about to clients, let me start addressing this to other coaches, health coaches, as you mentioned. Like, what was that shift of mindset that you had?
To be very much honest, this is the area, there's lots of pain in the community.
Mm, mm,
So much of pain, because I think for healers, health coaches, you get mild to moderate.
mm.
We get, you know, so I feel if even if for mild to moderate, these
Yeah.
tools can be combined.
Mm, mm. Yeah.
It can improve their outcomes.
Yes. True. Mm.
That's the thought process.
Beautiful. And when you started doing this, like, what were some of the responses that you got from people
I
who
have
were
just,
health coaches and?
to be very much honest, I have just started this
Ah.
process. This is beginning. When
Mm,
I started initially, I created, modules for my clients, my
mm,
caregivers,
mm.
because earlier that was the obstacle. Because
Correct.
somebody is coming to you for schizophrenia, you're talking about keto diets. Somebody is coming to you for a depression, and you are saying, I'm going to have 10 kg weight loss for the depression. Somebody is coming for the depression with PCOD. I want to settle their PCOD for depression. So earlier, it used to be a uh, communication issue with me and my clients for 3 4 years ago. When I have crossed that obstacle, now I've done, whatever I wanted to do.
Mm,
That's done. So it's like, what if what I have learned, at least basics of that
mm.
can be given to people. So
Right.
around 2 or 3 years ago, I started with this challenge. How should I communicate to people?
Mm.
You need to have diabetes reversal for mental health.
Right.
It was difficult.
Mm.
People used to say, "What's the connection with the diabetes
Yeah.
and
Yeah.
mental health?" People
Yeah.
used to say, "What's the connection of my gut health with mental health?" People used to ask,
Right.
"What's the connection with my menstrual cycle, PCOD, or thyroid with the
Mm.
mental health?"
Mm.
Now,
Right.
people working last 4 years or last two
Huh.
to 3 years created modules. People started
Mm.
understanding.
Nice.
I feel that is done. That challenge is
Mm.
done.
Huh.
Let's take another. Let's do something more than that.
Right. Nice. And
Yeah.
that's how you started saying, okay, maybe this audience I can address people who are healers and coaches working more in the mild to moderate
Yeah.
mental health.
I would like to welcome people for
Mm.
this kind of approach, because For example, someone is having obesity, definitely they'll get some improvement.
Mm.
Somebody's having diabetes, spirituality helps them. What
Right.
if you're working internal inflammation in the body?
Mm.
You're
Mm.
working at both ends now, front end and
Correct.
back end also,
True. True.
both ends.
Mm. Mm. Right.
No doubt, it's little personalized also, but at least
Mm.
basics can be done.
Mm. So could you tell us a little bit about, the kind of programs that you're currently creating where your intention is to help other healers and coaches?
Initially, I have created a basic module that is clinical diagnosis and differential diagnosis.
Mm.
Because
Mm.
initially, if somebody is coming to someone, this is anxiety, depression, or the personality.
Mm.
Because once you start assessing their personalities, you can little bit predict outcomes, or compliance will be better,
Mm.
outcomes will be better. Or if the gut health and mental health connections, basic nutritional, I'm creating on the lines of clinical diagnosis and differential diagnosis, the basics, including little bit of gut health and mental health connection.
Right.
This is the first module I've just created.
Mm. Right.
So, for example,
And
you're treating depression and someone is having bipolar affective disorder, something, some excitement or some mood issues in past.
mm.
If you're just treating on the lines of depression,
Mm.
you may not have good outcomes. So
Right.
at least basics of the diagnosis. No need to read about ICD-10s, DSM-4, the
Mm.
bada bada books. Basics.
Right.
It can be. It's simple.
Wow. And what are some of the things that you've heard coaches and healers and people who are in this space, how do they respond to what you're creating?
I tried these workshops with
Mm.
psychologists and nutritionists. I got
Mm.
good response.
Nice.
So I don't know about health coaches. What
Mm.
exactly are their challenges? I really don't know.
Right. Okay.
I know for psychologists, this is their curriculum.
Mm.
This is their
Mm.
curriculum. They need to have clinical diagnosis and differential diagnosis. They need to have
Right. Right.
for working with their patients to predicting
Mm.
outcomes. So that is there
Mm.
in curriculum.
Mm.
Nutritionists definitely they need because they are playing with nutrition, so they need to
Mm.
have basic.
Mm. Mm.
So this is their requirement for other healthcare providers also, but I really don't know about health coaches.
Right. Okay. And you, like I said, we met through, and in this case, it was through, Devismita, who you met in, I think, one of the communities. So, what brought you to these communities? Because a lot of people who are in the healthcare space, people who are professionals, tenured professionals, who never would have ever imagined, creating content, making reels, right? I mean, 5, 7 years ago, it was, you never would have thought of it. But with COVID, there's been a lot of shift in mindset and the awareness to be seen and to be, to be known. So, what was that journey like for you?
See, around 2.5 years ago, I've given my all social media work to someone.
Ah, okay.
So initially I've given, then I realized it's a lot of jig jig. Matlab,
Mm,
every day I was struggling because
mm,
I didn't have any technical skills,
correct.
and I knew whatever the work I'm doing, I need to
Mm,
express to the people. I need to inform that this is what I'm
mm,
doing.
right,
So that was wasting lots of time. So initially my challenge was it's a unique niche.
right.
How should I communicate to people? This is what I'm doing.
Mm, mm,
And how should I go for publications also, paper publications also, this chair chip? I didn't have any idea about any technical skills.
mm,
That time I joined ILH and came to know, and initially that were my challenges only.
right,
Simple. And for me, the basic things worked.
right,
Basic things worked. And
right.
I never thought of so much about community. This is the feeling now I feel because
Mm,
I've done all of that stuff, established clinic.
mm,
Now people are comfortable getting reversals. Everything is fine. So now this is the feeling which now I have, and even I talk to my integrated group of practitioners also. We need to do something.
right.
Though I am starting, I have
Hmm.
in my group, I have integrative dermatologist, integrative physician who is working
Oh.
on diabetes reversal. So
Hmm.
I talk to all.
Right.
Later or sooner, we need to start this.
Hmm.
We need to start this. This is the
Amazing.
need.
Wow. That's amazing. You know, the one thing I truly love about this time, this era that we're in, firstly, there's, literally like whatever information we have, whatever knowledge we have, there's so much more sharing that's happening, which never used to happen before. Like
Mm,
if you look at maybe 5, 10, 15 years ago, it was an unheard of thing. But
mm,
there's this openness today that, professionals, people who maybe they've just started off, or people who've been in this space for a while, there's a lot more sharing that's happening, and I think that also is what is creating this uh, you know added awareness amongst people. Like you were saying, maybe I'm talking a little technical. I don't know if people will understand it. I look at it like this: people who are looking, they will be glad that you were sharing this,
mm.
right? So there's a lot of that mindset shift that's happening, which brings me to a very interesting point of our pod. When we were talking last week, you talked something about hypnosis, right? Like, so let's shift gears a little bit. This is, of course, my favorite subject. I've been swimming in this Mahasagar for like decades now, but I'm very curious to know what was your journey like. How did you come across hypnosis, and what's that been like for you so far?
I haven't completed so much of that. It's around three
Hmm.
to 4 months of journey.
Right.
Started with Silva method books.
Oh, okay. Wow.
I
Wow.
found
That's.
very interesting, and I found results also that alpha wave. I felt level
Mm.
of productivity in alpha wave. It improves like anything. But
Mm.
definitely, I want to listen from you. And
So,
I really want to, because this is 3 to 4 months only, and I
yeah.
want to learn, or I want to understand what kind of people you're getting,
Mm,
what kind of
mm,
results
mm.
you're observing.
Sure.
I want to
I,
know.
I will definitely talk about it, but like I said, my intention of this pod is I am fascinated by people who are, especially like, somebody like you who's been on a certain track and you've been doing these things, and you're discovering these newer, modalities or newer challenges. So for me, that I will obviously share more about this, but I'm curious to know, like, what, like, how did you come across hypnosis? Because I'm saying this also because this is over many, many years. For a lot of time, especially in the medical profession, hypnosis is not something that is given it's like a passing, okay, it's there, but, let's not talk about it. But it's interesting to hear you on this track. And you talk about Silva, it takes me back to like 2007. Right?
Mm,
That's when not even 2007, it was like 2000. Wow, it was 2003 that I actually came across Silva, right? The Silva Ultramind method. And I think it's probably like maybe 40, 50 years. It's been around for that time.
mm.
But as I said, as someone has a scientific background, someone who's, a very solid background, when you start, looking at these areas of uh, um, just being human, it's like the visible and the invisible. I'd love to hear from you, like what got your interest in hypnosis, like why hypnosis?
I think this is human nature.
Okay.
We go for one challenge, we get satisfaction, then we want to
Right.
have next challenge.
Right.
This is human nature.
Right. So how did you come across it? Did somebody mention it, or was it like you saw something on your feed, or like what s- struck your
I don't
attention?
know. Somewhere, I think in some webinar, somebody talked about
Okay.
Silva's learnings. I started
Okay.
exploring his books only. I got
Wow.
five to six ebooks.
Right. Right.
There are 5 to 6 ebooks on Silva.
Mm.
So I started reading what exactly is this. And
Okay.
at the same time, I went to one conference of integrated practitioners only, and there was one doctor who was talking about alpha waves, beta waves. I was thinking, where from this literature is coming out? What exactly is talking? What is the source of this literature? So it was not mentioned in that lecture, exploring that. So that's why it's
Yeah.
part of human nature only. We all do
Right.
the
Of course.
same stuff.
Of course.
We
Of
all do.
course. Yeah. Yeah. Interesting. Have you reached a point where you now have started to, as you're learning, have you reached a point where you're starting to practice the hypnosis in any form at this point?
So I'm doing without a mentor, but whatever I am feeling, this meditative state is the
Huh.
best. I
Huh. Huh.
it's like it refreshes you
Right.
without anything.
Correct. Correct.
So it's beautiful. It's beautiful.
Awesome. Have you like started to, like you have hypnosis, then of course you have hypnotherapy.
No, I'm not doing anything.
Nothing at
I'm not,
this point.
because
Got it.
for me, like I get clients who are in difficult phases.
Yeah. Yeah.
For me, it's very important. 3 to 6 months, I need to give some
True.
outcomes
True.
in a short period of time,
Mm. Mm.
and it's a busy OPD practice. So,
Right. Right. Mm. Got it.
but
Got it.
I wanted to listen something right now from you. I'm
So
repeating my question.
no, no, no. Like I said, I will definitely share. I think what I have noticed in my practice, and I initially in maybe over the last couple of years, and I've been doing it over a period of time. In the very beginning, I used to take pieces of what I had learned in NLP or neuro linguistic programming,
Hmm.
because that again is something that has been around for around 40, 50 years. And I used to use pieces of it in my corporate training. So in one of my previous avatars, I used to be I used to do corporate training, but not the conventional where you do a PPT, or where you maybe in those days you would take a book, say like something like even Who Moved My Cheese, or you would have something like, let's say, the 1 Minute Manager. Like these are all the kind of, I'm talking almost about 20 years ago,
Hmm.
where you would either take a book and break it down and then use that as a teaching guide or reference. For me, in those days I used to use theater as the way to get people to connect, and for people to be able to, at one level, go deeper into their own stories, discover, like we talk about archetypes. These are some of the things that I used to work on way back. But when I discovered NLP or neuro linguistic programming, that, like what you're experiencing right now, the waves, and it's just like something that it's fascinating you. To me, that was fascinating because I had some amazing teachers back then, right? And so watching them do what they could do on stage, when I say on stage as in our training program, that was what caught my attention. Because for me personally, I did not see myself doing counseling in the way, the standard approach to counseling. I didn't want to do that. So I was like, there has to be a different way to help clients get results. And here I was watching almost like magicians doing things like phobia cures and taking people into altered states. So when
Hmm.
I saw that, I was like, that's me in a few years from now. Meaning that's what I'm working myself towards, right?
Wow.
So that journey has been over these last 2 decades now.
What kind of results you are getting? I'm
So
curious to know.
so it's let's say we look at relationships. That's one of the most typical places where a lot of people today have discovered their purpose. We, especially nowadays, we talk a lot about purpose. Like people, maybe you went to school, college, thinking you would do one career, and especially post COVID, people have kind of woken up to the realization that no, actually, I'm meant to do something else. As you, and it's beautiful, you talked about your grandfather telling you it is all about seva, you must do seva, right? So a lot of people are waking up to that realization that I have a skill, I have a gift, and as I give it, and when I give it in a specific way, I can not only build a business around it, but I can do it from that space of giving, from that space of really truly creating deep change. So that's one of the areas that I focus on, where someone has maybe realized that they want to be a coach, they want to be a healer, but there's a lot of disconnect between the identity of the healer and whatever identity that they've been carrying till now. So that's one very, very powerful area where I've seen some amazing changes happen. The other, of course, is relationships. People have been, struggling either to stay in a relationship or to get out of a relationship. So that's another space where I've seen, people have some amazing breakthroughs. In health, what's interesting is one of the quickest, and this is what NLP was very famous for back in the day, which is phobia cure.
Wow.
Right? So someone has a phobia, let's say, of heights for 40, 50 years. And in one session, which is like less than about 30 minutes, it's like gone.
Wow.
And then in the break, the person goes to their terrace, stands near the parapet and takes a video saying, I'm standing here, voice is absolutely clear and, confident.
And no relapses thereafter?
No relapses thereafter. That's one of the most powerful pieces of all of these technologies, if you want to call it that, especially when it comes to something like fear, not even fears, phobias, because it's a very specific response. Fears, even something like smoking, I have worked with people and there have been relapses because, again, it's all about installation. Like if you don't reset their internal system, sometimes it can come back, maybe after 6 months, maybe after a year, but that means it worked for a year, right? A lot of times people forget that and they're like, oh, it doesn't work. It does until it doesn't work.
Is it okay if I ask one more question?
Please.
So, when you're talking about identity, definitely it's a game changer. I'm also understanding.
Yeah.
But what my question is, after working on that,
Mm-hmm.
after working, are you observing some major health benefits also?
So typically there's a change in weight. There's also a change in mood. That's why I was smiling through all of your sharing with, here on the pod about how you're talking about it. Like just because someone has a, so-called psychiatric disorder, it's not just that. There are other aspects, right? So and that's why after all these years, today I have reached a point where I've simplified it. We just work on these technically two areas. One is your identity and two is the beliefs that you have. You change these two. Firstly, your toxic habits, you'll just let go of. Because we've all had this experience. It's like saying you suddenly discover you really love going to the gym or you love doing yoga. You'll also notice the night before, you'll suddenly become very conscious of what you want to eat and what is the latest you want to eat it. Because kal subah ka session hai. So suddenly that, oh, I have to eat sweets at night. It's like, I don't want to do it anymore.
Good.
Because you've become healthy or your identity is, I exercise or I am healthy or I am a health freak or I love health. So when you suddenly start associating with that, automatically your habits change.
Got it. It's total personality shift.
Yeah, exactly. And this is where, like I said, when you link it to what you do as a profession, meaning if you're saying, yeah, I want to help more people, then you're suddenly looking at everything from that perspective. So it's like you've discovered your purpose, you've discovered a passion, and you want to do that.
Got it.
So that's when you start taking care of yourself. That's when that starts to kind of, spin out into, you start not only caring for your family, but people who are in your extended community.
One more. It's an interesting subject, no?
It's an interesting subject and an interesting pod. Usually it's like, this is your space to share, but you're more than welcome to ask. Yes. Um, I'll be honest, I don't know, like I can give you a logical answer, but this is where, because you're talking about spirituality, it's like you're meant to receive certain things at a certain point in your life. For some people, they discover that their truth much earlier. Why? I'm sure you would be in a better position to tell me that maybe it's got something to do with their karmic records, maybe it's got something to do with their, their soul was meant to come here and have this experience. It's possible, right? And it again goes to your belief system. If you believe that there is such a thing as a soul, if you believe there's such a thing as, you know, uh, karmic records, then you're like, yes, that's exactly why it's happening. I look at it like this. This I can tell you. When COVID happened, it happened to everybody. I'll say it again. When COVID happened, it happened to everybody. So we all had some, it's like we all had some side effect of having COVID at the same time. Whether people got it or not is not what I'm saying. But we were all, you know, at home. We were all cut away from the world that we knew. And it somewhere it has created like a reset for us. And some people, when I look at it in like in the in the billions, it's like some people have had that awakening, right? And it's for people like us that we get to take this and share it with more people. It's not like, oh, I need to let 100,000 people know this. Even if 100 people get to know this, I know that each of those 100 is going out and telling at least one person, right? So I'm going to ask you two questions as we slowly start to wrap this very, as I told you at the beginning, this is a pod happening for a reason, right? So let me ask you this. Um, and this is something I discovered because of doing so many of these now. We're like now on the other side of 50, meaning we've done more than 50 pods at this point. Um, if I was to ask you, so Aarti, like what's your journey of mentors? Like who are these people that came into your life? You shared some already, but if you kind of like reflect back, like who are some of these people that came into your life and have played an important role as a mentor at different points on the journey? Sure, why not? Hmm. Ah, okay, right. Wow. Hmm. Wow. Hmm. 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 Wow. Amazing. Okay. Hmm. Hmm. Wow. Wow. Amazing. Yeah. Hmm. So I'm asking this question because when I started doing these pods and I started interviewing people who were at different points in their journey, initially, of course, it was a lot of people who are healers and coaches. One thing I noticed was that uh, there are times when people, for whatever reason, they're not able to say their mentors' names. I mean, this is again something I noticed. I'm not talking about in your context. I'm saying this is something that I noticed. And so that was what kind of was like a wake up call. And I said, no, I must ask because one, this is literally like the opportunity to express your gratitude for the people that have, because of them, you're here, right? And the other is, we don't know who's listening to this at what point. And maybe they only hear this part. And that person's name can become like that ripple effect in their life. Like to put it into context, my mentors, one was, he used to go by the name of Dick. His name is Richard McHugh. So he's like a retired Jesuit priest. Of course, he passed away a couple of years ago. But when I saw him for the very first time, for me, I was like, that's me. Because he showed me the possibility of how you can, like literally getting goosebumps, how you can take like what you're starting to learn now and truly transform someone else's life. And again, I just made that connection one more time. Because of him, I got to know about Vipassana. I got to know in 2007, but it took me 8 years to get to the Dhamma Center. Right? He mentioned it because he had gone to, he had done Vipassana meditation probably, I think, in the 70s or the 80s. And he literally was an epitome of that. Right? So, and of course, when I started going down the journey, I realized there is Dr. Richard Bandler who's still alive. Even to this day, he's still teaching. So that's when I was like, always, for me, it's always like go to the source. And so when I realized that, he was alive, I literally went to the US several times over to learn literally like at this distance. Like stages there, I'm here and I'm like literally like absorbing it all in over years. I'm talking like 2012, 13, 14, 15. So yeah, I'm so glad that, two things, of course, that we got to hear your story. We got to meet you like this. And I'm sure for people who, because today we understand the value of putting content out there, like content that will truly make a difference to other people. I'm sure that something that you said or just listening to your story, I know it'll inspire people, not just, as you said, now you're starting to look at also working with people who are in the wellness space, people who are healers. I'm sure the right ones will find you and they will benefit from who you are as a person. And of course, all your knowledge, all of what you have been doing all these years. So I know that is definitely going to happen. So before we wrap, of course, maybe one last question, if I may. If you could share, like, what's your vision for creating community? I ask this also because generally, doctors, at least in the past, it was more of you work in the clinic and it is a very intensive, uh, job in the sense that you're like from morning to evening, you're constantly like, in consults pretty much through, and it's a very busy life, right? But since something made you say, I'm going to learn, you know, understand digital marketing, and so in that sense, you're different from other doctors. What's your perspective on community, and like how are you looking to build your community? Hmm. Correct. Correct. Ha. Correct. Right. Mm. Correct. Correct. Yeah. Mm. Right. Hmm. 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 Wow. Wow. Right. Hmm. 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 Correct. Hmm. Hmm. Yes. 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 That's right. Yeah. Very true. Yeah. Hmm. Yeah. True. Beautiful. Beautiful. Thank you. Uh, as I said, it was my gut that was saying that this was going to be an amazing pod. Unusual. It's ticked all the boxes. And a couple of things, of course, as we start to wrap. Firstly, thank you, Dr. Aarti, for taking the time. I kind of lost track of time. Yeah, we're at about 10:36. So thank you on a Wednesday for taking the time to share your life, share your energy. And I know for people out there, especially those of you watching this right now, even if you're watching this later as a video, if you've reached this point, obviously you know that there's something about Dr. Aarti that you've connected with, and maybe you're somebody who's starting on that journey of, in the wellness space or in the healing space. And I'm sure, you one is, of course, you can reach out to Dr. Aarti. There are your links are already available, so they can definitely connect with you, follow you on social, and reach out, DM you, and whatever questions they may have. And of course, at the time, whatever programs, if you're coming out with, I'm sure they'll be able to access it. So, big thank you to you, Dr. Aarti, for taking the time. Right? And of course, for those of you watching this, a big thank you. And as I said, we keep doing these pods. The intention, of course, is to find some truly amazing people. And you got to meet one such person today. So, wish you all the best. And as I always say, remember to live your purpose. God bless. And of course, we will be back with another one. Until then. Okay. So, give me one quick second while I pause the stream here. Okay. And